Good afternoon, everyone. Welcome back after a Easter weekend, a long weekend. It seems like forever since I did a Facebook Live post, and it's only been 4 days. So I hope you all had a rest. I hope you all really had some time to contemplate and to look at yourselves. Today I'm going to be talking about intervertebral disc disease. So that is the spinal issue that most commonly occurs in Dachshunds, but in other dogs as well. So we'll look at that. It's quite a extensive topic. And hello, Lindy, welcome. Hope you had a good weekend. And I'm not sure I'm going to get through all of the information today. If not, then I'll continue tomorrow. There's a lot to share, and back dogs do make up, unfortunately, one of the biggest percentages of patients that we see at Animal Health and Hydro. And we see them across the board, and I'll get into that, from mildly affected to those that are completely paralyzed, conservative and surgical. We basically treat them all, and we work really hard at giving them a quality of life and to be able to function. So we want to get them back to functions of daily living. But I digress. So back dogs, back issues. So it's quite a mouthful. Intervertabral disc disease. Inter means between, vertebral, so between the vertebra, the disc between the vertebra, or disease of the disc between the vertebra. Okay, so we'll get into a little bit of anatomy and exactly what happens, and I'll even draw you a few pictures, because I always find that that helps me to explain, and it helps you to understand what's going on. Hi, Lisa. Breeds that are predisposed to this problem, we all know Dachshunds, and we think short legs and long back, and that's the reason that they have the problem. In fact, what they have discovered, as in 2018, there was a lot of research that was done. They have actually found a genetic component in Dachshunds. So when we look at the other breeds, I think it's just a matter of time before we find that there is a genetic component there too. The extent of the genetics is not yet known. Hello, Natasha, welcome. What we do know is that the genetics does play a role. And really what that means is, in those dogs that have the genetics, the genes that create intervertebral disc disease, what the gene causes is an early degeneration of the disc. And that starts from as early as 8 months of age all the way up to 2 years. So the degeneration or the weakening of the disc starts early in the dog's life, even before it's mature. And the degeneration is complete, usually at about 2 years of age. And most of the symptoms that we see in these dogs start from around 2, but more often around 4 or 5 years old, and up to 8, 9, 10 and older years of age. But we can see it earlier. So let's just have a look at the skeleton, and I'll explain to you. So some of the other breeds, hello Yanni, some of the other breeds that are affected, Pekingese. So again, short legs, long back, they're affected by a lot of other things. Pugs, also affected by a lot of other things. I had a request from someone on one of the pages to please talk about all the pug diseases. So I hope you're listening. This is one of the problems that we see very frequently in pugs, unfortunately, amongst other things like hip dysplasia, patellar luxations, along with eye problems, and of course respiratory problems because of their squashed faces. So the other breeds where we see this problem, beagles fairly frequently, poodles, and mostly miniature poodles, but I have seen them in toys and in standards as well. And then, so those are the younger dogs, and then we see what we term a Hansen type 2, which is a slower degenerative process, not as rapid as in the Dachshunds and the other dogs, in Labrador retrievers, in German Shepherd dogs, in golden retrievers. So those usually occurred around 7 or 8 years of age, and we see a weakening, and we see especially of the hindquarters, and more of a dragging. It's a little bit of a different. The symptoms are similar, but what occurs in the body is a slower process than what occurs with the Dachshunds and the Pekingeses. So if we have a look at the skeleton. Now I just got to try and get the skeleton in the right place. I think that if we use my body as a background, what I do want to show you. Hi, Mr. Bones. Hello, Jean. Hi, Melanie. So here we have the spine. Okay, so it runs from the base of the skull till the end of the tail, and most disc problems occur between the thoracic area, so the last portion of the ribs, and the first portion of the lumbar region. This area here is a very, very mobile area, and the disc there has to withstand a lot of pressure. The other area where we get disc disease is actually in the neck. Okay, and that can run. So in giant breed dogs, it can also be a problem. Great Danes, Boerboels, Rottweilers, there's an instability as well, which can also play a role. So the pathology can be different to the one that we're talking about in Dachshunds. So if you look so these, wherever we've got a piece sticking up, here's a piece, here's a piece, here's a piece, here's a piece. I call them sticky out bits. They do have a fancy name. But these bits each belong to one vertebra. Okay, so the vertebra really is your backbone that keeps you connected, and everything attaches to the vertebra. Between the vertebra, so now we've got two sticky out bits. In the middle there at the bottom is a disc. Before we get to the disc, which is on the underside here, in the center of the vertebra, for those of you that are meat eaters, in the center of the vertebra, there's always a hole, okay? And then all the bony bits that stick out. The spinal cord runs in that hole, okay? So the spinal cord runs from the brain to the tip of the tail, okay? So the spinal cord lies above the disc. The disc lies between the two vertebrae on the underside, okay? So we have bits of vertebra that come together. So if you see one vertebra, two vertebra, disc in the middle, hole for spinal cord, and above here you have the sticky out bits. Okay, so above here you have the sticky out bits, and here you have the spinal cord. Okay, let's just see if we can do this. Spinal cord, let's see how good my balance is. Sticky out bits, another vertebra, and beneath that bottom portion of the pen is the disc. Okay. The disc is a cushion. It's a shock absorber, same as in people. So if you think that every time this dog moves, if the head is that side, every time the dog moves between all those vertebrae, we get movement like this. Okay, that's up and down. But we also get movement to the left and to the right. So you can't really see that very well on the screen, okay? And we get rotational movement, okay? And the disc has to absorb all of that movement to keep the spinal cord protected. Okay, that's the job. If this is damaged, we don't get any nerve impulses that run through to the back legs. Okay, all right, depends on where it's damaged. If it's damaged in the neck, it could be to all four legs. Okay, so the disc itself, if you think of a cushion, the outside is quite a fibrous elastic capsule, and the inside is gel. So if you think about even a stress ball, if you had to put a stress ball between these two vertebrae, then it would be able to absorb the shock. Okay. Now what happens with degeneration is the capsule becomes hard, okay? And it becomes less elastic. So if something becomes hard, Neil, won't you bring them in and close the door, please? Sorry, just sorting out the dogs. If the capsule becomes hard and I now apply pressure, it can't stretch like it used to. So it's going to burst. If it bursts, that gel is going one way. Okay. If we, the other thing that happens is the gel also hardens. So we don't have as much compressive ability as we do in a disc that is normal. Okay, so we have two problems. We have a capsule which becomes less elastic, and we have inside the gel which becomes less absorptive. It becomes harder. Okay, and in some dogs on x-rays, you can actually see it calcify. Okay, so now what happens is I have a disc that actually can't do its job properly anymore. And for whatever reason, the pressures become too great between those two vertebrae. Okay, and the pressure forces the disc to go up. Okay, they don't come down, they go up, which is where your spinal cord lies. Okay, now if you remember, your spinal cord is inside bone. Now I've got disc material that's pushing this up against the top of the bone, of the column, of the canal. Okay, and when we get compression of the spinal cord, that's when we see the symptoms of hip dysplasia, of intervertebral disc disease. So it's the compression that actually causes the problems. Okay. So when we have a disc that has now herniated, prolapsed, popped, it's the same as in people, okay, we now have pressure on the spinal cord. And what does that do for the dogs? What it does is it's extremely painful, okay? And we will get trauma response around there. So we might get some bleeding. We'll get some swelling. We'll get sometimes, if that disc bursts completely, we will start getting reactivity and inflammation within the spinal cord itself. Sometimes the disc only bulges. So the capsule stays intact, but the disc bulges. So in the old German Shepherds and Labradors, that's more of what happens. In the other dogs, it's often an explosive burst that pushes that disc material up into the spinal cord and pressure up against the bone. And so when we have a little bit of pressure, we have dogs that are very sore. Some of them will bend their backs, okay? Some of them will cry when they get picked up. A lot of them will just show changes of behavior. So suddenly they don't want to jump on the furniture anymore or climb on the bed. They don't want to jump into the car. They don't want to play with the other dogs. So if you watched my post on pain in dogs, you will start to see a lot of those changes. But these dogs will also often cry because if it's acute, if it's sudden, it's quite painful. Okay, some of them, as we progress, as the pressure gets more and more, we start to see a wobbliness in the back legs. We start to see a drooping tail. So where the tail, especially in pugs with the curly tail and peaks, quite often, where the tail comes up, now we'll start to see a tail that's down and a dog that looks like it's got a stomach ache. Okay, from a veterinary perspective, it can sometimes be really difficult to distinguish between a bellyache and a backache. Okay, because the symptoms are often quite similar. Okay, they're sore, they're cramping. I mean, if my stomach is cramping, I'm also going to hold and I walk on 4 legs, I'm also going to hold my back like that. Okay, so as the pressure gets more, the symptoms become more intense. So we'll go from wobbliness to the back leg the paw that actually folds over and the dog doesn't correct it, to dragging, to complete paresis and paralysis of those back legs, okay? And then we can get anywhere in that stage, in those phases, you can get urinary incontinence and fecal incontinence. So usually dribbling and feces that often just fall out. So the dog doesn't seem to have any control over its ability to defecate. And vets will grade those symptoms from 0, where the dog is symptom-free, to 5. Okay? 1 is where there's pain only and what we term no neurological symptoms. 5 is complete paralysis, urinary incontinence, and what we call no deep pain. So we use progressions of symptoms to determine the degree of the injury. And now we come to, how can we treat this problem? Okay, so I often have clients that come in and say, my vet told me that if I didn't do surgery, I needed to euthanize my dog. And I would like you, every single one of you that's listening, and every single share that there is, to tell anybody who has a dog that is prone to disc disease that is absolutely, those are not the only options you have. And that's where facilities like Animal Health and Hydro and Animal Dynamics, thank you, Natasha, and Doggy Paddle and numerous other rehabilitation facilities come into play. And as well as integrative vets that are able to offer acupunctures and homeopathies and herbal medicines, they really can and do make a difference with the dogs where you can't get your head around euthanizing because the dog is actually still so alive and still so young, and yet for whatever the reason might be, surgery is not an option. We definitely have more than those 2 options. And if all that this Facebook post does is get out there that there are more options and people start asking questions, then I will walk away from here really, really happy. Okay, so we've done breeds, we've done anatomy, we've done symptoms. So now we need to look at options. Okay, so we've touched on options, and I think you can tell that I feel really quite strongly about this. So I'm going to end off, there's a few minutes left, I'm going to end off with starting to discuss options. Please send me questions. I'm going to carry on with this topic tomorrow at 12 noon. With regards to the things that we can do, and if there's any way we can prevent it, then we'll look at that tomorrow, because we really just don't have enough time to cover everything today. So we have surgical options, we have non-surgical options, and we have the option of euthanasia. Now, euthanasia, let me just discuss that first, is a very personal journey for the human companion as well as for the animal companion. And it is something that needs to be discussed at great length with your veterinary practitioner. It's not simply, well, if you can't do the surgery, we have to euthanize. We look at, when I see patients like this, I look at what's your lifestyle, what's your financial burden, how many people have you got in the house? Have you got people that can help you over this period? Have you got the financial means? Have you got the time? Can you transport the dog? Can you limit the dog's movements? So what I want to say is the number one single most important thing that you can do to assist recovery in your dog if it gets a back issue, that's a disc-related problem, is to crate rest your dog. Okay, no more jumping, no more running, no more playing. Outside on a leash and harness only for wheeze, and then back inside. No playing with the other dogs. Okay, and it sounds really strict. It lasts for 6 to 8 weeks, sometimes a bit longer depending on the dog. Everything is based on the individual. But that is a really, really short space of time in comparison to the rest of your dog's life and the other option, which is putting your dog to sleep. Okay, so depending on the grades, let's just quickly go through the surgical options. Depending on the grades, we will recommend surgery or not. So often the dogs that are only painful, we will treat conservatively with anti-inflammatories and recommend that you keep your dog, you manage your dog's movement. And really, it is about keeping them still in a playpen. Okay. Those of you that have watched my Dylan's Daily will see, even though he's not acute, he does get put into a pen because otherwise he'll traumatize himself. So a grade 2 is where we start getting a little bit of wobbliness. We've got the pain, a little bit of wobbliness, called ataxia. And some of those dogs, some people will opt for surgery. A lot of those dogs we can treat conservatively, and with your assistance, we really get good results. Okay, so if you follow the rules, I would say that a good 70% of those dogs recover and recover well. Okay. The next phase is where they start to really knuckle over and drag a little when they're walking. That's a grade 3. Incontinence can start to come anytime now. A grade 4 is where they actually still have what we call deep pain, but they don't move so well. They might be dragging. Incontinence might be happening here as well. Those 3 and 4 are surgical. In most cases, it depends again on the family, depends on your belief system. I have treated the whole range, okay, from 1 to 5. Grade 5, there is no deep pain. That means there is the most amounts of compression that you can have on that spinal cord. It usually comes with a very, very poor prognosis, even surgically, because the idea is that the damage is so great that even if you remove the compression, the compressive forces on the spine, the feeling is that the spine cannot recover. Okay, and so many surgeons won't do surgery on those dogs unless it has occurred within the last 24 hours. Okay, now it's all controversial. Okay, and I have seen dogs that have been a grade 5 that have responded to acupuncture and have gone on to walk again. I have seen dogs that have been a grade 5 that have gone for surgery after 5 days and have gone on to walk again. I've also seen dogs that are a lesser grade and they don't walk again. Okay, so everything is dependent on the dog and on how you then manage your dog going forward. Okay, so nothing is cut and dried. I would urge you to have conversations. If you are one of those dog people that has a breed that is prone to disc disease, inform yourselves so that if it happens, you already have a plan of action. I'm going to part with this and then we'll pick it up again tomorrow. Because when your dog has this problem, you are so emotionally distressed that you actually cannot make a decision that's in the best interests of you and your dog. So if you have a breed that is prone to this, talk it through, get informed, think about what options you have so that if it happens, you already have a plan as a family going forward. So I'm going to end it there. Thank you very much for all your time and your attention. I see lots of comments that I haven't had time to read. So I will run through them and I will answer those that I can, and those that I can't, we'll have a discussion about tomorrow. Thank you. Stay well. And I'll speak to you tomorrow at 12, Disc Disease Part 2.